This presentation is designed to give you a general overview of some of the characteristics associated with typical abused substances. It is in no way an all-inclusive presentation, but it will highlight the different categories of substances and provide examples of drugs that fall within those categories, along with typical side effects as well as overdose and withdrawal symptoms. FYI, any information in red is probably considered very important. Stimulants typically result in a person experiencing feelings of euphoria, alertness, and increased energy, as well as a decrease in appetite and need for sleep. Overdose symptoms include agitation, hallucinations, convulsions, and even death. Withdrawal symptoms include feeling of apathy, increased need for sleep, and general irritability. Some stimulant examples include cocaine and meth, but even ADHD medications such as Ritalin and Concerta. Hallucinogenics, as the name implies, typically results in a person hallucinating and experiencing an altered perception of time and a decrease in one's inhibitions. Specific effects for MDMA, aka ecstasy, often result in teeth grinding and jaw locking. That is why frequent abusers would suck on pacifiers. Another specific effect for cannabis is a decrease in appetite. Yes, cannabis is an hallucinogenic. Typical overdose symptoms include one's inability to move purposefully, such as ataxia, fatigue, sensations of pain, paranoia, psychosis, and possibly cardiac arrest. Withdrawal symptoms include the clients displaying drug-seeking behaviors, decrease in appetite, muscle aches, tiredness, and acne. Other examples of hallucinogens include LSD, PCP, mushrooms, and mescaline. Narcotics, also known as opioids, typically result in the user experience a feeling of euphoria, tiredness, respiratory depression, constricted pupils, and nausea. As you most likely know, narcotics are used in medical treatment, and when used properly, can be used to treat acute pain issues. Overdose symptoms include slow, shallow breathing, clammy skin, convulsions, coma, and potentially death. Withdrawal symptoms include watery eyes, runny nose, irritability, nausea, chills, and sweating, along with feelings of panic, tremors, and cramps. Examples include heroin, oxycodone, morphine, cough medicine, and fentanyl. It is very easy to overdose on fentanyl, as a very little bit goes a long way. In addition, fentanyl can be absorbed through the skin, so just brushing against someone with fentanyl on them can result in the person having an overdose. Depressants slow down the bodily systems, resulting in the person displaying slurred speech, disorientation, impaired memory, and an overall appearance of being drunk. Overdose symptoms include slowing of the breath, clammy skin, dilated pupils, coma, and potentially death. Withdrawal symptoms include anxiety, insomnia, delirium, convulsions, and potentially death. Examples of depressants include GHB, benzos, barbiturates, and of course, alcohol. It always amazes me how often people who are depressed and saddened about life seek alcohol to cope, when in turn it results in the person feeling more depressed and hopeless. Inhalants refers to any substance that produces a vapor that can be breathed in. Typical effects for the users include a flushing sensation, hypotension, headaches and brain damage, impaired memory, slurred speech, and a drunken appearance. Overdose symptoms include a condition of methylmyoglobinemia, which is a blood disorder in which abnormal amounts of methylmyoglobin is produced. In addition, there could be vomiting, respiratory depression, loss of consciousness, and potential death. Withdrawal symptoms include agitation, trembling, anxiety, insomnia, confusion, and hallucinations. Examples of inhalants include laughing gas, adhesives, spray paints, and lighter fluid. Consider for a moment the path the substance takes as it enters the body. It is a direct shot from the nose to the frontal lobe of the brain. Many inhalant abusers suffer from frontal lobe damage and also suffer with social skills as a result. In addition, metallic spray paint includes flecks of metals in them. Inhaling metallic spray paint can cause severe damage to the brain.